Here's a little project for all you bored computer scientists out there under quarantine. So we have a 3-liter syringe right here. We have a Venturi right here with a throat of 0.259 inches. And what we'd like to do is we'd like to measure the volume flow rate of a patient hooked to a ventilator with this type of flowmeter that can be 3D printed. And we want to analyze the data that is the difference between the height in these two columns, which is proportional to the pressure drop across the Venturi. And we want to use that data to calculate the total volume flow rate of a breath. So we can simulate a breath by pushing on this thing. You see you get a steady flow if you have a steady difference in the manometer. And then of course we can do it again, a little bit faster this time. And you see the manometer has a little bit of dynamics to it. It has a little bit of momentum and so on. So the columns of fluid tend to bounce a little. But what we should be able to do is use the simulation of the U-tube manometer along with the simulation of the Venturi and some decent image processing to calculate how much air is breathing out of a patient's lungs or into a patient's lungs. Because the more air that goes into and out of the patient, the more they're likely to survive. So the respiratory therapist needs this data to understand if the patient is getting better or not. So there you go. See if you can figure that out.